I am Dr. Srikanth Venkatakrishnan, consultant in physical medicine and rehabilitation at Narayana Health. The department was set up in earnest around 2.5 years back and has moved from step to step to increase its scope and value to those with disabilities. Rehabilitation medicine or physical medicine and rehabilitation is a relatively new and exciting field. It had its roots post the World Wars when a lot of soldiers with disability needed to be managed and rehabilitated. And in India, it took roots in the 1950s and 60s, and since then has seen a steady and gradual increase in its scope and relevance in the medical field. It helps patients and those with disabilities or those with difficulty in performing their day-to-day tasks due to medical issues or medical impairments. It is managed by rehabilitation physicians or physiatrists, and these physicians are trained to manage patients with disabilities and their medical care. Classically, patients with neurological conditions such as stroke, traumatic brain injury, Parkinson's disease, hypoxic ischemic injury, multiple sclerosis, spinal cord injuries, and cerebral palsy stand to benefit when a comprehensive rehabilitation team led by a physiatrist is involved in their care. In addition, patients with cardiopulmonary conditions, musculoskeletal and joint-related rheumatological conditions stand to benefit when a physiatrist is involved in their care. On a day-to-day basis, we see patients with a spectrum of presentations. When it comes to neurological conditions, they might have pain that is either musculoskeletal or neurogenic, weakness, muscle tightness or hypertonia, which can be either spasticity or rigidity, cognitive problems, communication problems, problems with swallowing, among the many presentations with neurological disease. When it comes to cardiovascular and pulmonary conditions, the patient might have breathlessness and cough that impairs their activity tolerance and reduces their functional ability. When it comes to musculoskeletal and rheumatological conditions, they might have joint pain and stiffness that impairs their mobility and quality of life. The process of rehabilitation can take place either in an outpatient basis or in inpatient settings. When it comes to inpatient settings, it spans the spectrum of hospital care, starting out from the ICU, transitioning into the high dependency unit or the wards, and then further on to the community. The rehabilitation team is multidisciplinary, and each member of the team has their specific role. The physician is involved in the medical care of the patient and in management of complications as and when they occur. They also manage conditions such as pain and spasticity with medications or procedures as and when relevant. In addition, they are involved in goal setting and guiding the team and the family through the time-bound and goal-based rehabilitation process. They also are involved in the care of tracheostomy tubes and the gradual weaning and decannulation whenever safe. The physical therapist helps in the maintenance of joint mobility, functional mobility, normalization of muscle tone, and to improve function through therapeutic exercise and physical modalities. An occupational therapist helps the patient and their family to gain functional independence with whatever impairments that they may have, either through exercises or compensatory techniques that seek to reduce caregiver burden and increase patient independence. The speech and swallow therapists help in addressing swallow and communication disorders for patients, either through therapeutic exercise, posture correction, textural modification of feeds, and gradual weaning off from tube feeds to oral feeds when they are safe. They also help with communication impairments through techniques such as volitional speech training and whenever relevant through techniques like augmented assistive communication. There are several other core members of the team such as neuropsychologists, rehabilitation nurses, prosthetists and orthotists, and one might also involve rehabilitation engineers, recreational therapists, among several important people who can add value to the team. In our experience, what we have found that really helps patients is when we guide them with the right kind of interventions, medications, the right kind of therapies and advice on how and when to do them, and the right kind of assistive devices and appliances that they can use at home with modifications they need to make in their home environment. When we give the correct amount of time, spend sufficient time with the patient and their family, deal with compassion, and we are honest about the process and its time bound nature, we find that this makes a huge difference to patients and their families. When you have people with disability, it is not only the patient who suffers, but also the family. And when we don't treat them with compassion, honesty, and the right level of care, there is a great deal of burden, financial and psychological, that is placed on the patient and their family. They might go skipping from one hospital to another, waiting for the next miracle cure. And this places a lot of financial as well as logistical burden on the patient and family. So they need the right kind of guidance on what to do, when to do, how much to do, and when to stop certain things and change track and direction. What we have found in the last several years is that technological advancements and newer treatment protocols and modalities have the promise of greatly affecting the quality of patients' lives. What we at Narayana Health wish to do is to provide comprehensive, cutting edge and cost effective solutions for those who need rehabilitation and their families.